Hello everyone. Today I'm sharing what I learned from my interview with Kellin McCullough, a licensed marriage and family therapy that works in Issaquah, Washington, who specialized in trauma therapy and EMDR. The full interview was about 22 minutes and a half, and for this 10-minute presentation, I'm focusing on the main theme that stood out to me: how trauma changes the way people view themselves, how safety is actively created in therapy, how readiness for deeper trauma processing is assessed, and why trauma work must include relational, systemic, cultural, and social justice awareness. Kaylin specialized in trauma therapy and eye movement desensitization and reprocessing, or EMDR. She also is a Washington State approved supervisor, so she supports therapists working towards licensure. What I appreciate immediately was that she did not describe trauma therapy as only a technique. She spoke about trauma therapy as a relationship, a pacing process, and a way of understanding the whole person in context. That was meaningful to me because it connects clinically skills with ethical presence. One of the most important ideas from the interview was how Kaylin defined trauma. She described trauma as anything that changes the way a person views themselves. I connected with this because it moves trauma away from only asking what happened to you and towards asking what did this experience make you believe about yourself. And we have been saying this in class. She explained that trauma can alter a client's self-worth, relationship with their body, and the way they show up in the world and in relationships. This helped me understand trauma healing as more than reducing symptoms. It is also about restoring the sense of self, safety, dignity, connection, and belonging. Kaylin described trauma treatment as relational because the therapist is looking at the whole person, not only the symptoms. She used the phrase that in EMDR work, the past is present. For example, if a client presents with anxiety or low self worth, the question is not only how do we reduce the anxiety, it's also how does this show up at work, in a relationship, in the body, and in the client's self talk. This stood out to me because it is very trauma informed. It honors that symptoms often make sense in context. They may be adaptations to early experiences. The therapist's role is to remain curious and compassionate instead of reducing the client to a diagnosis or a checklist of symptoms. When I asked how she creates safety in the therapy room, Kaylin first named authenticity. She said, "I am who I am." For her therapist, authenticity helps clients feel that they can also be authentic. That was powerful for me because safety is not only about using the right intervention, it is also about the therapist being grounded, real, and emotionally present. She also described practical choices. Clients can bring comfort items, choose where they sit, or choose what feels comfortable in the room. Some clients may want to sit um, next to the door or may not want windows behind them. She also talked about tone, mirroring, and allowing a full range of emotions. This taught me that safety is active. We build it through choice, flexibility, and non-judgmental presence. Another important question was how therapists know when a client is ready for deeper trauma processing, such as EMDR. Kellin emphasized resourcing. She looked not only at internal strength and coping skills, but also at external resources such as a family, community, spirituality, groups, and other supports. She also named parts work, ego state work, and IFS type work as ways to assess whether the client's whole internal system is ready. This connects with what we have learned in class about not forcing trauma processing when parts of the client are not ready. She emphasizes grounding skills, psychoeducation, informed consent, and sometimes collaboration with other providers. For me, the main message was that readiness is ethical. It protects the client from being pushed too fast. Based on the interview, I synthesized 5 key elements of trauma healing. First is safety. The client needs emotional and physical safety before deeper work. Second is relationship. Healing happens not only through the technique, but through the therapeutic relationship. Third is context. Trauma symptoms must be understood within the person's family, culture, identity, and systemic experiences. Fourth is resourcing. Client needs internal, external support, including grounding skills, coping strengths, and community. Fifth is pacing. Trauma healing cannot be rushed. This slide captures my overall learning. Trauma healing is not linear. It is a process of rebuilding trust in the self, the body, relationship, and the world. Kellin was very honest about the emotional weight of trauma work. She described how difficult it can be to hear people's most painful stories, especially when the client's experiences touches something similar in the therapist's own life. She also shared that after having children, trauma stories involving children carry a different emotional layer for her. What helped her was having a grounded orientation, trusting the process, doing her own therapy, receiving supervision, practicing in consultation, and having a community of therapists around her. I appreciate that the phrase from one of her professors: do not let your clients go to bed with you. For me, this means we cannot care deeply and still need boundaries. Sustainable trauma work requires that counselors also care for themselves. The relational, systemic, cultural, and social justice theme were very important in the interview. Kellin shared that her graduate program was systems oriented, which helped her understand that clients are shaped by family system, culture, identity, social location, and large structures. This matters because trauma does not happen in a vacuum. She also spoke about cultural humility. She said it is important not to expect clients to educate us, but also not to assume that because someone looks a certain way or seems similar to the therapist, we know how they feel. Even when the client seems similar to the therapist, we cannot assume they experience the world the same way. This reminds me that social justice in counseling includes humility, curiosity, self examination, and a willingness to uncover our implicit bias. This interview helped me think about the kind of counselor I want to become. I want to lead with safety by asking what helps the client feel physically and emotionally safe. I want to honor the whole person by understanding symptoms in the context of story, body, relationships, and systems. I also want to practice pacing and consent by not rushing trauma processing before the client has enough resources and readiness. I want to stay culturally humble by continuing to examine my assumptions and biases. Finally, I want to build sustainability through supervision, consultation, personal therapy, community, and boundaries. My main professional takeaway is that trauma counseling requires skill, but it also requires presence, humility, and the courage to keep doing my own work. I want to close with Kellin's reminder to trust yourself and trust the process. For me, this sentence captured the heart of the interview. Trauma therapy is not about rushing towards a technique or trying to fix the clients quickly. It's about creating enough safe choice, connection, and support so that healing can unfold at the client's pace. My final learning is that trauma healing means making space for the client's whole story while also holding hope, cultural humility, and ethical responsibility. Thank you for watching. The core of my presentation comes from the interview. You can watch it on YouTube. You have the link here. And the EMDR resources are included for educational purposes. Bye.